You're sitting at home one evening watching the news. Breaking news, there's a confirmed case of Ebola in Missouri. You start wondering, is this maybe somebody that I know? Is it someone that I could have come in contact with? Who is it? What should I do? Ebola is a rare but deadly disease. It causes internal and external bleeding. The Ebola virus is becoming an epidemic. But if we know how the virus is transmitted, the protective equipment that healthcare professionals are using, and the signs of the virus, it can help us to prevent the spreading of it. First, we need to know, how is Ebola transmitted? Spread by contact with skin or bodily fluids of an infected animal, such as a monkey, chimp, or fruit bat. It also moves from person to person in the same way. If you're around an infected person, maybe a family member or someone, close friend, that may have it, you can also get it. If you were taking care of someone that has just maybe recently died from the disease, you can also get it. Also through contaminated needles or surfaces. So if someone that is contaminated with this virus touches their mouth and then touches a doorknob or something, you can contract it that way by touching it and then touching your face. You can't contract the virus from air, water, or food, or a person that has no signs or symptoms of the virus. Second, we need to know the signs and symptoms of this virus. Most people describe it kind of like the flu. I agree and disagree with that. It is a little different in some ways, although it does cause headache, high fever, joint and muscle pain, also sore throat, weakness, stomach pain, lack of appetite, and eventually bleeding internally or from your eyes, ears, nose, or mouth will occur. Third, we need to know what protective equipment healthcare professionals are using to prevent exposure. If you want to go to the doctor, you want to know that they have done everything they can to keep from getting Ebola from their patients. They use gloves. This leaves the hands covered, so there's a barrier when touching your patient. You won't get any body fluids or come in contact with their skin. They also wear a mask. This is in case someone is bleeding. It protects their eyes, ears, mouth, and nose if that blood may travel to them at some point. They can also use gowns. This protects any skin and clothing that may be exposed by body fluids or contact with that patient. Also, they try to limit contact with the patient that may possibly have Ebola. This ensures that they have less of a chance to catch the virus if they're making minimum contact with that person. WebMD pointed out that there is no vaccine for Ebola. To avoid getting the virus, you should avoid traveling to places that the virus is found. However, there is treatment for Ebola. It includes fluids and electrolytes, blood pressure medication, blood transfusion, and treatment for other infections. The fluid and electrolytes are going to help keep patients hydrated and feeling better. If they're getting dehydrated from lack of appetite, it's going to help them get more fluid and feel a lot better. The blood pressure medication is going to lower their blood pressure, which can help with their headaches too. Blood transfusions are going to help replace any blood that the patient may have lost from bleeding. And also, your blood level needs to be at a certain amount. If it's any lower than that, people start feeling weak and dizzy and have other complications as well. Treatment for other infections is going to help the doctor rule out that this may be another infection and ensure that it definitely is Ebola. This way, that patient can get the proper treatment and the doctors can use the proper precautions for this patient.